Hello, my name is Corsiglia and I'll be presenting on rheumatoid arthritis. So a few of the topics we're going to be discussing in this presentation is first what rheumatoid arthritis is, what are its causes. Two, we'll go over the impact on the human body. We'll also go over kind of how physicians will diagnose this autoimmune disorder, go over its major signs and symptoms. We'll also go over the various treatments that are present for rheumatoid arthritis and then its relevance in the world today. Before we understand what rheumatoid arthritis is, we need to kind of have a good idea of what arthritis is overall, which is essentially just joint inflammation. So there are various different types of arthritis present throughout the world. The most common one is osteoarthritis, which is due to usually old age. So that's why you see a lot of elderly people get knee replacements or hip replacements, things like that, which is just due to extreme use of the limb over time, which can wear away kind of the synovial cavity, as well as the protection barriers between the bones, preventing them from rubbing against each other, which is why osteoarthritis is a big deal for elderly people. You also see psoriatic arthritis quite a bit. Sometimes you see commercials for medications for psoriatic arthritis or psoriasis. So psoriatic arthritis is a result of inflamed and scaly patches of skin, and then obviously rheumatoid arthritis, which we'll discuss in a little bit here. So rheumatoid arthritis is different from the other forms of arthritis that I mentioned because it is an autoimmune disorder. So meaning the immune system attacks the body's own tissues. So on the right hand side here I have an image showing a healthy joint and then a joint with rheumatoid arthritis. So you can see the various immune cells that are present within that joint cavity. So the immune system specifically attacks the synovial cavity. So it will attack the synovial membrane as well as the synovial fluid, which the synovial fluid is kind of a lubricant between the joints, which prevents the bones from kind of rubbing against each other like this to keep them nice and healthy. So you see with the joint with rheumatoid arthritis, you see the various immune cells present in there that are kind of influencing those synovial cells to attack itself, which causes immense inflammation and affects other areas of the body. So the major joints that rheumatoid arthritis affects are the ankles, shoulders, knees, fingers, wrist joints, etc. And then rheumatoid arthritis is also a non-organ specific autoimmune disorder, meaning it does not attack a specific set of organs. It attacks many organs are damaged as a result of the major inflammation caused by rheumatoid arthritis. So the main culprit, the main cause of rheumatoid arthritis are actually helper T cells. Those are the main culprits. So deviant T helper cells will send signals to various other immune cells to then attack the body's own tissues and influence those synovial cells to become destructive and inflamed. So the mechanism behind this stems from people with certain genes. So the main gene that can cause an individual to develop rheumatoid arthritis is your human leukocyte antigen DRB1, HLA DRB1 listed there. And so these can be triggered by smoking or various infections if the person has this gene already present in their genome. Certain environmental triggers or sex triggers can cause an abnormal immune response due to these genes. And so this abnormal immune response will usually stem from citrullinated proteins. So the immune system will incorrectly recognize self during maturation as well as during post-translational modification. And so those citrullinated proteins become anti-citrullinated proteins in the immune response, which then cause autoantibodies, which is an anti-citrullinated protein, so rheumatoid factor. Those are produced, which influence the activation of T and B cells to then recognize self as well, release various cytokines that will then cause major inflammation and joint damage. So this is kind of a diagram here to give you kind of the overall process of how the immune system will first be triggered to recognize self. We'll go through abnormal immune response, and then we'll then end up triggering those synovial cells to become destructive and inflamed. So some contributing causes to rheumatoid arthritis. There's no single known cause for rheumatoid arthritis. There are mainly just environmental factors that can increase your risk of developing it due to the presence of certain genes that you already have within your genome. So like I mentioned, the HLA DRB1, that can be triggered to alter immune responses due to environmental factors like the ones listed here. So women are actually more likely to get rheumatoid arthritis. This is typically due to genetic predisposition, so just the differences between the male sex chromosomes and the female sex chromosomes plays a factor in that, as well as hormonal influences. So mainly estrogen is believed to play a major role in the fact that women are also more likely to get rheumatoid arthritis. Family history is a contributing cause. This is mainly due to obviously certain triggered genes, certain genes that are more likely to cause immune system alterations. It can be passed from parents to offspring. Smoking is also an environmental trigger. Being overweight, as well as the middle age group of people in society, are also more common, more likely to get rheumatoid arthritis. So like I mentioned previously, rheumatoid arthritis is mainly just joint inflammation due to the immune system attacking the body's own tissues. And so this inflammation can then impact many other areas of the body, which I'll go over right now in these various impacts of RA. So the lungs can be impacted, so you can develop lung disease as a result of rheumatoid arthritis, and this is typically due to just the increased inflammation throughout the body, which can then lead to increased inflammation in the lungs. Heart disease can result due to chronic inflammation as well. That inflammation can damage blood vessels and hinder blood flow to and from the heart. Some people can develop osteoporosis, which was just very much the weakening of the bones, which increases your likelihood of breaking bones as well. And then your immune system already attacking your own body leaves it exposed to subsequent infection due to also medications that you may take that also may kind of weaken the immune system and leave it susceptible to other infections. Cancer is also a common illness that can develop from patients with rheumatoid arthritis. So that chronic inflammation can increase blood cancers, especially lymphoma in the lymphatic system. And then it also impacts your skin. So various rashes can result from those areas of inflammation underneath the skin due to the joint inflammation. And rheumatoid nodules can form. So rheumatoid nodules are essentially just large lumps underneath the skin that result from the inflammation in the joints. Rheumatoid arthritis can also cause dryness in the eyes and the mouth. And then it can also impact the body's ability to reproduce, to produce red blood cells. And so typically patients with rheumatoid arthritis will also develop anemia over time, low blood cell count, because they have they're not as good as reproducing red blood cells. So those are the major kind of impacts of rheumatoid arthritis, which develop various symptoms. And so these are the three main symptoms of RA. The major one is joint pain. So when you do have rheumatoid arthritis, obviously you're going to have very stiff, painful, and swollen joints because of that inflammation. And so typical people will, after waking up in the morning or after getting up from sitting down for a while, they'll be a little bit stiff, but they're able to walk it off in a few minutes, depending on the age there. But people with major stiffness due to osteoarthritis or rheumatoid arthritis will remain stiff for about 30 to 45 minutes after getting up from waking up, or from sitting down for a while, things like that. As well as redness and warmth at joint locations can be a major symptom of joint pain as well. And then fever, fatigue, and weight loss can result because your immune system is so busy fighting your own body tissues as well as any subsequent infections. It's very exhausted, your body is, and so doesn't have too much energy to fight off other infections, which can lead to fever, fatigue, and weight loss. And the third final symptom, major symptom that doctors will notice are rheumatoid nodules, like I mentioned, and any skin rashes. So physicians will primarily diagnose rheumatoid arthritis by doing first a medical history. So they'll see if anyone in your family has, in the past, had any symptoms relating to rheumatoid arthritis, or if they've had any history of rheumatoid arthritis itself. And then from there, they'll do a physical exam and analyze your body for any joint pain, any joint stiffness, as well as nodules or rashes. And they'll also do any lab tests, so they'll test for certain antibodies as well as inflammation by doing blood tests. And then x-rays will reveal any bone damage, cartilage damage, anything like that, to see if there's any damage to your joints. So here's an image of an example of an x-ray of a human here with rheumatoid arthritis in their hands. And so I'll direct your attention specifically to the red arrows. It's pointing to major bone erosion there in the knuckles of the hands, which is a major symptom of rheumatoid arthritis, as those immune cells are actually attacking the various cells in those joints. So there are major treatments for rheumatoid arthritis. There's no cure for RA, but these various treatments help limit the progression of the disease, and they also help treat the pain and discomfort that can come along with this disease. And so the major one are various medications. So NSAIDs are non-steroidal anti-inflammatory drugs. Those are your over-the-counter, typically ibuprofens, which can be taken at high doses. That helps treat the inflammation and the pain. Your next available treatment for medication is DMARDs. So these are disease-modifying anti-rheumatic drugs. So these are your first line of defense against rheumatoid arthritis. They help slow down the progression of the disease. If these don't work for whatever reason, they'll then try biologics, which are specific targeted treatments of immune complexes involved in rheumatoid arthritis. And so that would be your next treatment available. And then steroids are always very, very helpful. Typically your cortisone injections, which help treat inflammation and pain. Outside of medication, you can get physical therapy, which help you strengthen your muscles, surrounding muscles around joints, as well as increase your mobility, which can heavily decrease when you have joint pain and things like that. So physical therapy helps relieve some of that pain as well as strengthen your overall muscles and increase mobility. And physicians will typically monitor these various treatments and kind of see if you're improving, if you're not improving over the course of weeks and months. And if for whatever reason you're getting worse or you are not improving symptoms like pain and inflammation, they will then resort to surgery, which would be a joint replacement usually. And so this is their last resort for treatments. And like I mentioned, there's no cure for RA, but these various treatments essentially relieve pain, decrease inflammation, and they improve physical capacities to perform kind of your daily tasks. And so rheumatoid arthritis, what is its relevance in the world today? So according to the World Health Organization in 2019, about 18 million people developed rheumatoid arthritis. 13 of those 18 million showed symptoms that could be improved by taking by being involved with these certain treatments, like the medication and physical therapy and things like that, which is a very good sign, which means that well over half of those individuals with rheumatoid arthritis improved due to the simple treatments. And like I mentioned, hands, wrists, knees, ankles, etc., all those various joints are mainly affected by rheumatoid arthritis. And then out of those 18 million, 70% of the people were actually women, which I mentioned the various causes of that. And then 55% of them were middle-aged, so showing how women and middle-aged individuals are at most risk for rheumatoid arthritis. Thank you for listening.